Many of the youngsters who are doing angioplasty today have never seen that background and never faced the difficulties. They've come in at a stage when the beautiful stents are available and they think angioplasty is also easy to do. They haven't realized the journey that all of us have faced with the balloons and the problems and having to sit in the cath lab, having been told off by the surgeon saying, I told you not to do the angioplasty when it didn't work and we had to send for emergency surgery. They don't realize all these problems. They think it's so easy for the stent come out in 15 minutes and oh, such an easy procedure. Dr. Ashok Seth, of course, you are the flamboyant man of the angioplasty field. You've always been again at the forefront of doing new things. As I always noticed, you know, the absorbable stent came, TAVR came. So tell us what makes you excited to go into these new fields, because all said and done, it is a lot of mental stress. I mean, you're dealing with sick patients who could die under your hands. So how do you deal with it, especially when you're doing new technologies and complex technologies? And maybe give us some background of your journey of angioplasty as well.
So Jamshed, firstly, let me just say I'm just privileged and happy to be amongst such stalwarts like Dr. Kim, Cherian, Dave, Samuel, Matthews, because these have been the pillars of creation of both surgery and angioplasty in our country. Even though we are all senior and we all sort of have lived this life together along with you as well, I would say that even amongst the seniors, I'm the youngest, the bacha of the four stalwarts. I still remember, and I think it's a very wonderful journey that we've had together over the last 33 years. I returned back from England in 1988, October, trained, in angioplasty, but a young guy at the age of 34. And I still remember the lovely time that there were a handful of us doing angioplasties at that time, when Dr. Palajani, Matthew, myself, and a few others got together in Mumbai in 1989 to first start discussing angioplasty cases amongst each other. And we had this wonderful meeting where we showed our cases and talked to each other. And by the way, we were only 10, I think, if I was correct. And after that meeting, that was my first meeting with Dr. Palajani. He's already an established stalwart in the field of cardiology and invasive and interventional cardiology in this country. He was a big man. And he took me aside. And I was this young boy who just come from England. And he said, can we go out for a drink after this? He took a liking to me. We sat down at Sky Rock, sitting on the sea. And he talked to me for a couple of hours. And he treated me to a beer, 2 beers. And then finally, when he left me, he said, Ladka acha laga. Ye lambi race ka ghoda hai. Bahut dur jayega. I still remember his lovely comments, which is like a pat on the back for me. That's why I think of Dr. Palajani as even a grandfather of angioplasty. I mean, he's actually a grandfather of cardiology in this country. So with those words, yes, it's been a tremendous journey. And I tell you, whether it's Matthew, whether it's Dr. Palajani, whether it's me, and whether it's you even, when we lived through those times of the initial times, we were actually breaking barriers. There was no question. We believed in the technique, even though there was a 5% risk of a death, a 5% risk of patients going for, 10% patients going for emergency bypass surgery, 5% risk of a death, patients crashing after angioplasty after a few hours, theater standing by, the cardiac surgeon breathing down our neck, giving us 1 hour to do an angioplasty where he would keep the theater vacant. And yet, if you actually see that, we not just did angioplasties and simple vessels, we proceeded to multi-vessel angioplasties. We proceeded to new devices because 3 facts were very clear. And to me, they were very clear. I said, I think this technique would actually work and can be perfected with skills, with acumen, and with belief. And all of us who pioneered this technique and pushed it forwards with that belief. The second aspect was when you talk about new techniques, we believed in our skills. Indians have superlative skills. And we believed very clearly, and so did I did clearly, that if I saw one, I would do one, and with my skills, I would start teaching the next day. Third aspect in our beliefs was very simple. We had to make sure that India was recognized throughout the world for everything that we actually did. So we were ethical, we were compassionate, we were caring, we never were cowboys. We made sure that we gave the best skills to our patient, but we actually believe that we will not be the 50th country in the world to start off a new technique. That if American can do it, so can we. And that is how we lived our life every day, saying we would put India on the map of the world for interventional cardiology, because West had to see what India could actually achieve. India was always thought to be one of those backward countries where we still had the best brains and we had the most skilled person, but we could never project ourselves in the international sphere. And so that was always one of the important things in our mind. And then finally, the reason of coming back to the country was giving India what could be had in the West. That was very clear. It was not that we were trying to be great. It never occurred to us the fallout of what we were doing. The fact that we became great was just an automatic aspect of our ethics, our compassion, our care, our perseverance, our focus. It was just a fallout of that. But we actually believe that India needs to have an infrastructure as good as the West. And that still drives me to do whatever I do, that we've got to be a leader as an Indian, not as an individual. It's not Dr. Seth performing the first. It's India doing the first. It's India it's ourselves putting India on the map for the world to say, ki yahan se we can actually shine and do those things which perhaps most of the world has not seen, and then teach the world in those. I think that's the passion that we're going to actually take for us. Just one thing, Jamshed, it was very fascinating, even early on. We were doing such techniques, and I say that we, because I know Matthew and Dr. Palajani, all of us were doing such techniques that I remember a case in 1992, anomalous left vein arising from the right coronary sinus, going in, and also, of course, following the non-malignant course. Ostial LAD, 3 lesions in the circumflex and 3 lesions in the right. Total of 8 lesions. We only had balloon angioplasty those days. I did those with balloon angioplasty, all 8 lesions in single sitting in 1992. Now, we would even be scared to do that in the days of stents. Now, when I sent it for publication in the West, I was refused the publications from 4 journals saying that we don't want to exemplify this sort of a procedure because that is heroism and sets bad examples. 2 years later, the patient came for some chest pain and I did an angiogram and all 8 lesions were looking pristine, including the LAD ostial lesion with balloon angioplasty. That got accepted as a publication saying, guys, you're great. You have proven that angioplasty, balloon angioplasty shines and can treat such difficult patients. And it got published in the Western Journal, in the International Journal of Cardiology. So we had to push boundaries to that level to be recognized across the world as Indians doing some of the toughest cases.
Thanks, Ashok. Thanks for sharing your past and your experience.
Was shattered after the press conference, and Jamia would remember, I didn't open my mouth. I asked you to speak because I was so scared that what would happen if something had gone wrong.
Thank you. I do remember that extremely well. And of course, the dramatic recovery that the patient made, he was breathless on ventilator. And within few days, he just got out and went home and started back to his politics. So indeed, a great reminder of what can happen if you take a little courage in your hands and do the work. Ashok, you work in Delhi, so your pressure may be at a different level. Do you think working in Delhi with a different set of politicians and celebrities, how is your experience with managing these celebrities? Because I think youngsters, I'm always scared, as Matthew said, because when things go wrong, it really reflects on you and it can really be it can make or break your career for some people when things go well or bad. So being in Delhi, do you feel is different from being in another city, or how is your experience with dealing with these super VIPs?
So you asked a very difficult question, but it actually affects all of us in some way or the other. See, for example, a young interventional cardiologist working in a small city may get the VIP of that city itself, who would actually be the most important person. And then all eyes are on that young interventional cardiologist. It happens in other cities. It can happen to everybody. And then, of course, on a bigger scale, it happens to all of us in metro cities, and we actually meet a lot of VIPs. But the way to approach this always has been, is to be just focused and blinkered, because you're not doing a procedure on a VIP, you're doing it on a patient. You do not look at the implications. You always believe in yourself because you've done it before umpteen times and multiple times. And you secure yourself in the belief of, firstly, having done it multiple times before. Secondly, making sure that all systems are into place, like call it the checklist manifesto. And finally, trusting God, because He's willed it for you at the end of the day. And I sort of have a strong trust in God, because none of my patients would get better if I didn't have that belief in God. For example, I want to tell this to the youngsters. You do 100 patients, and there's a one who actually has a perforation, but you did that same thing multiple times and you still get a perforation. This happens to all of us, and therefore you believe in Him to take you on the right path and never give up that belief. That is the recipe for success, and I can define that. Jimmy, I actually wanted to say that doesn't bother me so much. Believe you me. It's only because it doesn't bother me so much because of these two things which I've said. And I just leave it to God and say, my hands, my skills, I've been through it before. I'm not looking at who he is. I'm looking at him as a patient. Tomorrow there'll be a similar patient with exactly the same circumstances, and I'll do the same thing. Two things in my life which have changed me has been non-professional related. Of course, in a professional manner, I would say, it's when I did my dad's angioplasty at the age of 86. Multi-vessel disease, and thank God, he's at the age of 98 and still doing well. That was the toughest moment of life because I had to rotablate multiple complex lesions and then stent him. And it was a prolonged procedure. I had to be sure of the diet, to be sure of many things. And when you're doing it to your own patient, there's only so much blinkered you can be. That's one time. VIPs doesn't worry me. Once it's your own dad or your own mom you're doing it, that's the toughest, because then you can't think of them as a patient. But I did. I blinkered myself, had every system into place. The only thing which happened right at the end of the procedure, I perclosed him. The perclose slipped. It was my fault because I was just so, suddenly the weight had come on of a successful procedure that suddenly the implications of what could have happened during the procedure struck me so badly that I slipped on that perclose and I pressed his groin for the next 4 hours as he was anticoagulated, but luckily no complication occurred. And the one thing in my life which has transformed, and by the way, my dad is doing very well and thankfully so. So that's one procedure that I will always remember throughout my life as the most defining procedure in my life. My other defining point in my life was a very funny situation, and I want the youngsters to start understanding that if they see me as a leader and an icon, then remember that I took 3 years to get into medical college. I could not pass an exam. And therefore, I had to, after pre-medical, I had to do a second year. I still couldn't pass it. I had actually got to a third year. I should have got into medical college in 1972. I got in 1974. So successively, I failed the entrance exam. Once I got into medical college on a second waiting list at the Aligarh Muslim University, the only time I actually got something, I didn't get any other college. And I'm happy I got Aligarh Medical College because I think it's a great institution. I'm proud of it. The first 1.5 years went by in absolutely enjoying myself to glory. My parents lived abroad in Zambia. I had nothing to be, stuck to. And actually, I failed every exam, the internal exams of my college. I was actually having a fun time. Till the first professional, where people came and told me, and I was just sitting in my room, the exams results had come out, they were stuck on the board, and I didn't even go to look at them because I was not expected to pass the first professional. And actually what happened was that somebody came up to me and said, you've actually topped anatomy. And I said, there's no way I can top anything. And I didn't even go and look at it. Late in the evening, when everybody had gone away, I went to the notice board and actually saw that I had topped. My name was on the top. I couldn't believe it. And I went to the, as would have it, I was shocked. The tradition was that you actually go to the professor and head. If you're topped, you got a gold medal, you just go and say, Gertzi, thank you. And I did that 2 days later. And the professor of anatomy looks at me and asks me who I was. And I said, I'm so-and-so, I'm Ashok Seth. I've actually got the gold medal in anatomy. I topped anatomy. And he said to me, how did that happen? Ashok Seth, you're Ashok Seth, how did you actually top anatomy? Now look at the ridicule of the whole situation. I decided on that day that either I've got to succeed again. And if I don't succeed again, and if I don't have more gold medals, and if I don't top again, I either end up being ridiculed, I end up being criticized, or I end up being forgotten. I wasn't ready for that. And from there on, it changed my life completely. I had 3 more gold medals. I was one of the brightest students subsequently, and I never failed from there on in anything which I did throughout my career. It transformed me. And I think those are the defining moments of your life. It may make me realize that you cannot slip up anymore because expectations are too high for your own self, not from others, but from yourself. You elevate your expectations beyond something. And I was bright, but I had nothing to elevate my expectations. I was having a good time in life.